Romeo 42 back on radio after code 0.
10-9.
I said Romanoff 42 back on radio after code 0.
10-4.
Sierra 84 going to the most recent 311.
10-4, have fun. Yeah, but I also answered you. So how is you? I said Sicky, and you said I'm also Sicky, twins. Okay, babe. Sorry. Let me look into something real quick. You there?
Yeah.
Okay. But I did reply in the first place, so. Okay, we tried compression socks.
Compression socks.
They are... So basically compression socks are like knee-high elastic socks. They help improve blood circulation that can also reduce your pain and the swelling that is caused by blood clot.
If they work, then I suppose I'd give them a try.
I mean, it doesn't hurt to give it a try, right?
Yeah. I may look goofy as hell.
I mean, you won't really tell unless you show everybody them, because it's going to be underneath your...
Yeah.
Everything
you're right,
else.
You're right. Just lift my pants. Look at these new knee highs.
Oh my god.
Look at my knee highs.
Excuse me. Oh, you happen to have some water on them? My bad, I had a little headache. Probably chopped on your voice. Yeah, like some water. Nah, I can run to the stove real quick.
Basically, with this, we can try a couple days, we can try weeks, we can try months. That being said, it all depends on how the swelling goes and how your pain is.
Appreciate you, both, man. My sugar felt
Because we have had you on warfarin, and it's helped,
I work here. I know
as I can tell. We can try the compression socks on top of the warfarin. And I would say come back in a couple of days, at least 3 days. And we can see how that's working. And if that doesn't work, the warfarin's not working, then we might have to do a surgery for it. Which I know you don't want to do.
Yeah, I don't want that.
I think he's like a British accent.
You just really need to... Okay, Nemo.
Oh,
We're just gonna...
you know when you...
We're just gonna have to see how it goes, okay?
Okay.
And we can start that tonight. I can help you put them on.
Look at my knee highs.
I just say finish off the warfarin tonight. And then before bed, I'll help you put them on. And then you'll learn for the next couple days.
Sounds good. Thanks, baby.
Is someone working on Gregory Corbett?
10-4. Sorry, I code 0
where?
during it.
Where are you?
In exam 2.
Yeah, 84 is heading back to Pillbox. I was able to treat the patient on scene. It was minor cuts.
What you doing?
I am doing a checkup.
Arlo, what the fuck are you
What kind
doing?
of checkup, huh?
What the fuck are you doing here, Arlo?
Yes, it
What kind
was a
of
checkup.
What kind of checkup, huh? Was
That's
it-
if he
was-
wants you to know, he can tell you.
Naomi
No
just
booty on
texted
duty.
me.
Okay, well, I'll leave you guys alone.
Bruh.
What'd you say, Nemo?
Said no booty on duty.
Well, we're not doing that. I'm literally doing a checkup.
I will tase
Wait, are you
you.
allowed to do that?
I asked Lena, and she said yes.
Okay, I'll take it's like just surgeries and shit that you're not allowed to do.
Yeah, that's what I wanted to clarify. It's any surgeries and stuff like that that is like probably the
Awesome.
line that I shouldn't cross.
Naomi messaged me and she said, "Don't be playing doctor in there."
Okay, I'm going to add another comment saying
Arlo just said, "Who's the good and who's the bad?" Oh my God! She said, "Who's good doctor and who's bad doctor?" I'm gonna put the both of them into a book.
okay.
Alright.
No, I'm not like assertive.
Fair enough. Yeah. You're not assertive.
Yeah.
Alright.
I feel like I'm not assertive.
We were not
Yeah.
playing doctor in there.
You sure about that?
I am
Who's the good doctor?
sure.
Who's the bad doctor?
I'm the good doctor because I actually know what I'm doing.
Oh, so she's the
Okay,
bad doctor.
So did he tell you what he said earlier?
No.
Thank
No.
you, baby.
Do you wanna tell her? Or do you want me
We don't need to.
What did he
no,
say?
I know. I want to know.
What did he say?
I want to know.
All right. Look. We were about to attach to a B boost, right? And out of nowhere, Scott Diaz, one of the supervisors for BCSO, goes, "Hey, we're buying food for everybody for free at the VU for PD." And I was like, "All right, $4.90.76 a VU to collect some free food," because I was fucking starving. And Naomi goes, "No, we're not going to the VU." I was like, "But free food."
And
And then she was like, "Scarlett will fucking kill me if I go to the VU." And I was like, "Dude, we're not going for the ass. We're going for the food. Free ass and free food. It's just eye candy for you." I mean,
I went there yesterday and tonight.
You can cry on command? Or on
Yeah, tell me to
demand?
cry.
Let me hear that.
Yeah, tell me to cry.
Cry.
I'm gonna go ahead and clean up your road rash, bitch.
Thank you. I'm trying so hard not to
Oh, that was entertaining.
Oh my god, thank you.
You're welcome.
Ah, God.
Oh my god. Dusty.
Huh?
Which knee?
Hold on. Let me walk again. I think it's the right one.
You think it's the right one? All right. Does it feel like it's the bruising or?
No, it feels. I get. You know. Fuck.
Words.
Hold up.
It's okay. I get the same way.
Let me
So,
think.
You want that kid off the
so you
meme.
know. Oh my god.
We're gonna go on a couple dates actually when I get out of the ICU. And see how we feel about each other.
Oh.
Hmm?
I don't know.
I get told though that if Maz and I do get together, I have to wait 4 months before I get married again.
Oh, by who? By who?
Naomi.
Why so specific? Why so specific?
Because to be fair, the last marriage was a bit rushed, so I kind of
mean-
get where she's coming from.
Yeah, okay, that makes sense. But I was just wondering why so specific, you know?
Okay, originally it was 3.5 months, and then it was like, no, 4 months. She also threatened to handcuff me to the bed.
Had to have been a reason.
Hmm?
There had to have been a reason.
She basically, the reason was because she told I think she told Odd and whoever else it was that she would keep me here and I wouldn't leave until I was released. I was gonna leave anyways until I was released. Also, I kind of need some drinks. I'm a little bit thirsty. Thank you.
You're welcome.
Because I gave all my pumpkin cold brew to Maz. That. You know what? I'm not gonna question it.
Oh, fuck.
Arabella, where do you want
You're gonna have to carry him. I can't carry.
to? Yeah, where do you want to
Well,
T1.
OR.
go? Or
Or
I mean, if he's
Yes,
been
get my
amputated and shit.
goddamn.
you want help with holding shit or?
No, I'm good.
Okay.
Thank you.
Yep, I'll be right out here.
You wanna maybe like give the patient his little final touch there, just to so that shit doesn't happen. That's not what I meant.
I did know what you meant.
Okay, I'll be right back. I gotta go get my scrubs. I'm gonna go grab my scrubs. I'll be back. Just 1 sec.
Want me to break down the list of injuries for you?
Oh, give me a second. Go ahead and attach to that call. I'm gonna need yours. Go ahead and attach to that call. Alright, go ahead and give me a rundown.
Okay, so total list was a amputated leg, carving in his chest with 2 theater masks, a slit throat, though it was shallow, did not penetrate the airway, and there was something with his hand that someone's working on. That's pretty good as well, but it's
Okay, I'm gonna be honest with you. You are going in and out when you're speaking that I can barely hear you. I heard amputated leg, carvings in chest, slit throat, carvings in chest. I didn't hear the thing in between that.
yeah, of 2 theater masks is what the carving is, and there is something wrong with his hands. It was tourniqueted by someone before I got there. I didn't have time to examine before I worked on everything else.
Okay, go ahead and look over it then. Dr. Phil, I am gonna need you in here, please. Thank you.
I believe I saw something about the next artery or nerve is what they said before they code zeroed and had pop.
Is he on an IV?
Yes, he has started on O negative blood.
Okay.
All right. Looks like one of his arteries was nicked, but nothing major in that hand. But that's why someone tourniqueted it.
It was nicked? Okay. Alright, well, I'm gonna focus on that then.
For sure. Stumps. Stump.
Alright, when you have a chance, let me know if it's the left or right leg and the left or right hand.
See here. Stem his right hand. was the leg, was and the left leg severed at the knee.
Okay. I'm gonna go ahead and make this incision a little wider so I can see it better. There's nothing foreign in his body, correct? Like
No,
foreign.
the objects were removed on scene by other personnel.
No objects were, you said?
No, the objects were removed.
What were the objects?
I believe it was a knife in the hands, and that's all I saw. Yeah.
You removed,
I didn't.
or they
Oh, they're
removed?
fine. The responding officers removed. Yeah,
Okay. I'm breathing. I am breathing, I
Okay.
promise.
in fairness, they immediately packed it, so.
That doesn't matter. You don't remove an
I know,
object that isn't somebody.
Yeah, I know.
Okay.
It's fine. It's fine.
No, they could have just. They probably just made everything fucking worse. Okay.
It's fine.
Okay.
It'll be okay.
Alright, I'm gonna go ahead and have you put some propofol in his IV for me, just to put him. Actually, do you have an ID for him? So we know what he's allergic to and not.
It's the officer outside says his name was Kane, so it's DOC. Let me check it.
Yeah, see if we can get a CID.
For sure. I check his pockets, but I believe the officer took the ID. Okay. CID reads off as 35469.
First Longstaff, okay. Oh great, he doesn't have any medical information. Okay, I'm gonna yell at DOC to get their fucking people some medical information. That being said, can you see if you find an allergy bracelet or any, like, dog tags that have any allergies on them for me? If you don't find one, good.
Well, if they see nothing, I assume nothing, so.
Yeah. But I really don't want to assume until I confirm.
That kind of thing would be. Yeah, I'm seeing nothing, so I'm assuming clear.
Okay, then we're clear. Go ahead and apply some propofol. And check his vitals for me.
Okay. Let's see what's what here. His pulse was weak last I checked on scene.
We're gonna clamp this artery.
Sure.
I need you to remove that tourniquet.
Okay, remove tourniquet. Blood should start
Are we
flowing.
thinking extremely high or low blood pressure? Not blood pressure, fucking heart rate.
Sorry. It was very sitting around 50, low 50s, high 40s.
Okay.
So definitely not good. But it's,
I mean,
it's
not
climbing.
bad, but not good.
I mean, before it was sitting like at 40, so
Yeah, no. No.
it's climbing.
Okay, if that gets any lower, then we'll have to give him some atropine. Okay, just if you're able to have that ready. I would say replace his blood bag because of the blood he has lost. You do have a tourniquet on his leg, correct?
10-4 hit, and I have some gauze wrapping up that slump.
Okay. I would like you to replace that gauze, because it's probably bled through.
For sure.
Thank you.
So
I'm gonna go ahead and see if we're able to suture up this artery, or if I'm gonna need to do a grafting.
sure. Okay. More blood flow. He used about 2/3 of his first bag on the way here. Half of that one, and then we're Ma'am?
You know what? Did you do any kind of blood stopping medication when you were out there?
Negative. Didn't want to
Okay.
see that.
Can you do me a favor and give him some TXA?
Did you say? Okay.
It will help with the bleeding. It should stop, not stop, but slow the bleeding down a bit.
For sure.
It's supposed to stop the bleeding for like somewhat severe injuries, but this severe, it'll at least slow it down, but it probably won't stop it.
Okay. So we'll take same fluid line now.
Still try to see if we can suture, if we have to graft. I didn't see anything there.
I'll assume just. I would assume suturing.
Okay, so suturing is if the artery is like not in. If if suturing can help, it will probably be easier because suturing is meant for like nicks and smaller injuries to arteries, or you know, if an artery was clean cut. A grafting, an arterial grafting, is meant for if the suturing will not be able to hold. So I will try to suture and see if this holds.
For sure. Thank you for explaining. I learn more every day.
I've had an artery graft before. It was not fun.
I would imagine not. Even how many times have you been in surgery? 3 at this time? 4?
Have I been in surgery?
Yeah.
Here, only 2 or 3.
Okay.
In my old state, probably like 20, but that's because people kept torturing me and kidnapping me and shooting me. It was fucking annoying.
Yeah. Right. Suture.
I'm assuming suture was the second option. I don't actually know.
I believe suturing was the first. Yeah, it looks like a suture's not going to hold it all. Sadly,
I'm gonna check this. We're gonna check this real quick. See if the suturing is. Because it is a nick. I just want to see if the suturing is available. If not, we're gonna have to do a graft.
Yeah. Better place the bandages on his carving.
Still trying to see here if the suturing on the artery holds. Slowly removing. Okay. All right, clamp can be replaced then. There we go. Taking the clamps out. Go ahead and put them on that tray. I need section and irrigation, please.
Starting. Let me know when it's good.
What's your call sign, sorry?
Me, Echo 7.
I may or may not be taking mental notes while I'm doing this too, because it's gonna be a while.
Do you want to work on the carvings? They don't look so terrible. They look just this one.
Okay, no, because carvings for me are not a priority. The leg is a priority.
10-4.
Okay, you said the throat didn't.
There was a slice of throat, but it did not puncture the airway.
Okay, are you able to suture that up for me then? Clean,
10-4.
saline and suture.
Right. Loosen off just a bit.
Gotta look at this leg. You said the left leg. Oh,
Like, yep.
hold on. He's facing down. Left will be where you are.
Yep.
Okay. Oh, great. I'm gonna carefully unwrap this and see how clean of a that sucks to say was. Do we end up retrieving his leg?
Yes, CID retrieved it. I think he's waiting outside with it still, on ice though.
Okay. I'm going to check this part and see if this one's still intact to be able to reattach.
Want to go grab the leg anyways, or just...
Yeah, go ahead and just in case.
Hey.
Can you grab that leg real quick?
Yeah, I put it in the ambulance.
It's in the ammo. I'm gonna go grab it off the ice.
10-4. That sounds bad to say. I don't even know if people can actually reattach a fucking leg, but welcome to GTA 5.
Got the leg. How's it looking?
Okay, I'm gonna have Dr. Phil look at the leg. That part, the one that is not attached to him, and see if it is healthy enough to be reattached. Because this one is, but that doesn't mean that one is.
I'll set this up on the tray over there. Broken expected. Stop taking his time, isn't it?
Seeing anything?
10-9, sorry?
Seeing anything? With the other leg?
Not really. Like, just it's terrible, but I can recheck.
Yeah, because I need to know if it's even worth trying to reattach it, because this one is healthy, but the other one doesn't necessarily mean it's healthy.
Let's see here. Yeah, I suppose you're right, and if the body rejects it, ouch. Body, well, leg looks like it can be reattached. Not seeing any damages that would prevent such a thing.
Okay.
All right,
You gonna bring it over here then?
for sure. Okay, where do you want me to set the leg?
Perfectly in place with him, just don't put it on backwards.
Well, I didn't think that was going to be a risk until you said something. All right, let's all this in place here. You leave the retouching Dr. Joe, or?
Sorry, give me a second.
Or stick there.
Okay, I need you to check his vitals, make sure everything is going decent. And place his blood bag as well, since this one is still pretty bloody.
Alright. Let's hope that that's. It's probably above 50 now.
Hey, Doc.
Yep.
I'll be back here in just a moment. I gotta go back to the screen real quick.
10-4.
I'm at 22.5. Anything comes up or if you are goes, okay? I'll live at that.
Yeah, that last part might not be for a while.
Okay. Keep me in the loop, please.
Will do. Who is this, sorry?
SI 17, James Rossetti.
Oh, it's City. Hello, City.
Hey. Alright, I'll be back.
For sure. He was the guy that responded to last fiscally.
Alright, I wrote that down. Alright. Oh my god.
He was also one of the first on scene. So that sheriff, whose name I can't. Pink hair.
Okay, carefully microsuturing some muscles, ligaments, and tendons.
Sure. Vitals have climbed more. They're sitting well at 50 now. I'd say mid 50s. Not quite 60s yet, but anything's better than it was before.
Okay, just keep an eye on them.
For sure.
Do some tissue grafting.
Right.
We'll see if we need tissue grafting, that is. Basically, if a ligament has been torn, tissue grafting is the best way to more or less graft it. But in this sense, I don't know if it's just been like clean cut or if it's like torn. Okay, it's clean cut, we're good. Alright, no tissue grafting is needed.
Yeah. Guess lucky that the janitor found him as quick as he did.
Do you remember exactly where we are looking at being suffered, by the way? Like above the calf? Above or below the knee?
He was severed at from the knee, so
above or below the knee?
I believe it was below.
Below the knee? Okay. That'll be easier then. Alright, final suture on the tendon here.
look to be holding. I think it's just those chest coverings left once you wrap it up.
Okay.
And the TXA seems to have stopped most of the bleeding, so.
Okay, I'm gonna suture some nerves here that need to reattach after this. I will cauterize ones that
Yeah.
need it. And then those blood vessels here as well.
How long do you think is going to be wheelchair bound for?
We'll talk about that after. I need to focus on this, sorry.
Of course, no worries.
Okay. Apparently cauterize.
Yeah, please.
Pasteurize. Fucking English. Yeah, so I was cauterizing any blood vessels that are non-essential, while I also suture blood vessels that are essential. Alright, that part is done. I'm gonna now go ahead and apply a rod to both sides of his leg here. Now we'll do some plates and screws.
Alrighty.
I am gonna want to put him in an immobilizer cast. Immobilizer brace. There we go.
For sure.
Basically one that locks in place. Okay, can you do me a favor and check and see if you feel a pulse in his leg?
Yeah, it's there. It's faint. I'm assuming it's blood working its way back through, but it is there.
Good.
Yeah, it's actually a really good sign.
Would you ever think that this is the first time I've actually had to reattach somebody's leg? Or literally anybody's body that was not a finger?
That's fair. That's entirely fair. Well, it went surprisingly well for a first time.
It went amazingly for my first time.
Yeah.
Damn, okay.
I thought he was gonna pull.
You know, medical for 5 fucking years, and I've only ever once seen this, and I am dealing with it now.
Nice. Oh,
The last person I've seen it to was not alive, so
Yeah, no, that not same.
this one's alive, and I really needed him to stay alive.
Exactly. The last time I saw any limbs unattached was the previous Sisyphus killing, which was also well, he died on the scene, so. I kind of hope it's not a serial killer and just they both chose the same locale. Is that bad?
I mean, given he literally had his leg chopped off, had been carved and slit and stabbed, I would say it's a serial killer.
Yeah, it's
Or at least a
It's similar
killer.
injuries to
Because
last-
serial
it's-
killer
yeah.
would have to have more than one victim and would have to, you know, have killed them.
he has. Well, assuming it's the same guy, he has.
At least one that we know of does not make you serial killer. 2 or more does.
Fair point, actually. So
With
actually, yeah,
the
this
same
guy
MO.
lived. Exactly. This
Yep.
guy lived. So therefore, it's a shitty killer.
Uh-huh.
Yeah.
Well, we're not out of the woods yet.
Well, yes, but I like to have hope. I hope our city catches this guy.
Pulse check.
Yep.
All right. Thank you for helping.
Leg, hand, throat, chest, chest. This is the last thing I have to.
Yep. Just those carvings.
You did this. What?
That's a suspicious call.
That's very suspicious. Yeah, I expect the left leg's pulse to be faint for a little bit,
Yeah.
as we just reattached it. The fact that there's even a pulse in the first place is a good sign. We need the blood flow to get back into it, so at this moment, this is enough for us to tell that at least it's somewhat working. Give it a couple hours to a day to see if this pulse gets any better. If not, we might have to re-go in there and see what's not working properly. Do me a favor and replace his blood bag once more, as, you know, he's finally reattached. I will never say that ever again, probably.
I certainly hope not.
I really hope not.
Yeah, BPM's holding steady, still at that sort of 50, 55 range.
Okay, what's his blood pressure? Normal is 120 over 80. So if it's 120 over 80, I'd be very happy because that is really, really hard to actually see it at that.
I expect probably closer to 190 range.
I would expect more than that, given we just gave him a blood bag and we just all but the carving has been taken care of. And TXA
115.
115 astolic, how about dystolic?
Looks like
So-
it's sitting
115 over
115 over 100. That's what it looks to be sitting at.
over 100.
Well, 9.
80 is what we want to go for. We want less
know.
than that if we can. But if we have more than that, then we need to stop giving him blood. This will probably be the last blood bag by what I'm seeing.
Let's check that real quick. Oh, there it is. 115 over 80. Is that pretty?
That's really good.
Really good. All right. I'm gonna start slowing down that blood flow in the bag.
Just we'll just finish this last bag and then he should be good.
For sure. Want to reduce the flow of the IV or just let it keep going?
Just let this bag happen, because this one bag's not going to do too much. I mean, it'll probably get his asystolic up a little more,
All right.
which doesn't really matter. We kind of want that.
Yeah.
Alrighty.
I'd rather slightly high blood pressure than low.
Yeah, because at least slightly high, we can give him medication.
Yeah.
Or just have him slowly go back down. If it's too high, medication. If it's nearing just a little over, then we can just have him naturally go back down and just keep an eye on it.
And 4.
Okay. Okay, the chest carving. That's what we're gonna work on now.
Yep. 2 theater masks.
Okay. We want this to heal up before we do any grafting. This is gonna be a future thing, especially because grafting is gonna be a couple times.
Sure.
So
Does it necessarily require grafting, do you think, or?
I mean, unless it's causing him physical issue, it does not require. That is more a if he wants it. Now that being said, I don't know how much skin is missing, so depending on how much skin is missing, we might just do a single graft here and then do grafts later on over time. So let's see. I don't know what a theater mask actually fucking looks like, if I'm gonna be straight with you.
You know the happy sad mask?
Happy sad mask?
You never seen that in front of a theater?
No.
Like the white mask with a smiling face, the white mask with a frowning face?
Okay, is it the mouth and the eyes, or is it just?
Just mouth and eyes.
Oh, okay.
Get to those. It's like 2 jagged straight lines for the eyes and a carved smile and a frown, plus the tracing of the mask itself. So. fairness, most of this guy's injuries were clean cut, so I'd expect those to be clean as well.
I'm gonna see if, with Dr. Phil, if he wants grafting at this moment. Okay. So at least we can do some minimal grafting now. It's at the chest, so we can,
You're taking donator tissue, or is
I mean, we can see about donator tissue, see if we can find one around the skin color.
I'll go check the coolant lab. Let me see. Just grabbing a skin tissue.
What's up?
Just grabbing skin tissue in the lab.
Okay.
In the meantime, I'm gonna go ahead and clean it out with some saline.
Also, it's
Okay, so what we're gonna do is we're going to go ahead and attach a small patch of it to, let's do it to the mouth here. We'll cover the mouth with one patch and see if his skin matches it enough. Just go ahead and put it over the mouth.
let's see if that theater mask now can be covered up. Really need a never seen a theater mask before. Looks like it can't really be covered.
I'm confused.
Maybe I took a section that was too small. I could try cutting it a bigger section. Since it should be able to attach.
Yeah, I'm a little confused.
I'll try.
Like, yeah, not gonna lie, that confused me. Just want to see if it matches close enough to his skin color that it wouldn't really be noticeable from a distance. Now, with a grafting can always be done as long as he's not completely skinned.
For sure. Alright, yeah, that matches. Okay.
Okay.
I mean, worst comes to worst, you can pull some off his. Is it the thigh or the ass? Is it both?
Huh?
What do we pull the skin graft tissue from on the patient? It's the ass or the thigh?
It can be the inner thigh, the buttocks, the like right below the collarbone, in front of and behind the ear, depending on how small or big you need a graft, the upper arm, the neck, and one other area that we do not touch.
Noted.
This donator skin graft should be enough to cover this first mask. I'm gonna go ahead and currently suture this to here.
I'm just glad the graph comes pre-meshed.
Alright, let's see if this covered up the first one good enough.
Alright.
Mouth here. The outline. There we go. Alright, now we're going to work on the second one. Try and cut the same amount that you just had if you have enough there.
Yeah, there should be enough. That's what the meshing is for, after all.
Alright, let's see if this is good. I don't know who CB is. Let's see if this is good enough or if we need any more before I suture it. And any future graftings can be patch-up graftings,
Yeah.
if need be.
Looks good enough.
Oh, sultry?
Suturing.
Oh,
Suturing.
suturing. Okay. Uh-huh.
It's fine. It's fine.
Oh, it is 7 and I feel like it's midnight. Why is that? What is
Everyone's-
today?
Yeah, I feel like everyone's tired today. So no fucking Lorenzo or Brandon that went off is their turn. One, two. By the way, everyone's sleepy. I'm gonna exit and go eat some food real quick.
Bruh. But we're almost done.
I'm gonna pass out if I don't eat.
Oh, okay.
Yeah.
Just make sure you wash up before you come back over.
Don't worry.
antibiotic, and then we're gonna go ahead and put some sterile gauze and a wound dressing here.
Gloves, please.
Alright, sterile gauze and wound dressing has been applied. Now, let's look over him one more time, see if there's anything we have missed.
Right, let's see here. The neck was wrapped with gauze and stitch. Arm, leg, chest. I think he's good to go. Want me to start closing out the propofol?
No. Check his vitals again. And remove that empty blood bag. His blood pressure should be normal, but I want to make sure.
Alrighty.
And I also want to check his oxygen levels.
Sure, right.
Sorry to interrupt. I'll be back again. I gotta go check another area.
10-4.
Okay.
That O2 stat feels unhealthy.
Yeah, because O2 stats are... I feel like Nurse Nancy might have either mixed up her numbers and doesn't know what the O2 stats actually are. Natural, healthy O2 stats that we want to reach are 97 to... 97, 98 to 100.
Yeah.
Let's just, like, double check. There you go.
Okay.
98.
Come on, Nancy. You know 70%'s like practically dead.
We're gonna pretend that I don't have a fucking oxygen mask over here, motherfucker.
It's fine. It's fine. It's fine. It's fine.
And I'm not dead. Nasal cannula, O2 mask, same fucking difference, actually. It's okay. I'm more upset that Evander said 70 because you're practically dead. No, my brain just didn't like my oxygen I'm getting, okay? Hush.
Mm-hmm. Right. We got this. Vitals are stable.
Okay, are we wanting to... I would assume I know exactly where he's gonna go. But, I have to ask either way. So, Nurse Nancy, you think he's gonna go to ICU or recovery? Don't give me that sass, Nancy. I thought I was your favorite, Nancy. Me and her are pals. I would stand up for her all the time.
You don't need to pick favorites. I think. Fair enough. What you thinking, Nancy? 48 hours? 72?
She just clicked her fingers at me. You know what, bitch? It's on.
Don't so.
It's
We'll
on.
see him. We'll see how many hours. 48. All right. Is that your phone or his phone?
That's mine. It's my boyfriend calling. I'm gonna have to not answer though. You know, his timing for hang up.
Okay.
Okay, let's see. I know one is in use.
I don't think 2 is, unless I'm mistaken.
Yeah, 2 is not in use. 1 is apparently in use by 2 people.
What is?
1. Maybe not?
Was Marley checked out?
What?
No, Marley's in 4. Yeah. Who else is in 1?
I was in 4.
Yeah. Who was in 1? Well, I know it's
Um,
Rachel and who else?
The one before that, but that one was from December. So I'll have to go
Yeah.
back and see if they were actually discharged or what. I will do that though. So yeah, we'll put him in 2.
10-4.
I'll go ahead and, do this.
For sure. You admit him, and I'll contact Mr. Bristow over the radio and let him know that he's being admitted to ICU.
Yes, and then see if he wants us to wait with the emergency contacts.
10-4. Pulse 25.5.
Oh, hello.
Hello there. I'm assuming going to ICU.
Oh, you're
Yes.
right there. That was with radio.
Okay.
Yeah, he's in ICU. That's what that's. Do you want me to hold off on contacting any emergency contact?
Babe. I'm sorry I didn't answer.
You're fine.
I've been in a surgery for an hour. I can even move. Hello? Wait out there, I'll be right with you. Go ahead and get you right over here. Give me a second, sorry, chat. Alrighty. I'm gonna go out there. We're just gonna go ahead and set these up. We're gonna reverse this propofol. Gonna attach a morphine drip and some amoxicillin to the IV here. There we go. Alright. Now I'm gonna go ahead and put this little 3-on-1 button here for whenever he wakes up. Knock knock. Okay, you're still here. Give me a second. Come follow me.
Hey, Arabella.
Send it.
Do you have a report number yet, or is that something worked on?
Currently working on.
10-4. No, just let me know what the number's up, then they can send them a request for it.
And when did you plan on telling me something was wrong, Rachel?
Hey, you didn't get it from me this time. Yeah, no, I just gave her the I'm gonna go yell at my boss because I didn't get a call or a text or anything. And I am her first IC contact.
Sorry.
I am getting it. Give me a minute.
Um,
I am one human being, okay?
I was planning on telling you last night, actually, but you'd already gone to bed. Also, did Naomi gaslight you? Please tell me she did.
Yes, she did. She actually scared the living shit out of me, which is why I was going mock Jesus down San Andreas.
I'm leaving.
Here.
I'm leaving. I'm trying to hear radio. 10-9.
She's gonna gaslight you. It is gonna be funny. Yeah, no, I'm okay though.
Did somebody just hop on our radio for a second, Evander?
10-9?
Did you hear somebody hop on our radio for a second?
I did, yes.
Okay.
Sir.
Hey, there's a call, by the way, a 311 call.
Good, or I'll go.
Active 776, so if you're one regarding the fire hot.
10-4, yes, fire hot, fire bad. Make sure you tell them that.
Don't worry, I think they know, judging by the tag in their 311.
Oh, I know. Just tell them Arabella said that.
Noted.
Alright, I am gonna look over your injuries. Where did you get shooted?
I think just below my knee.
Okay, is it large through and through or grazed?
No, I have to just look.
That's what I'm looking for. Okay, it looks like it's through and through, so I'm gonna go ahead. Are you allergic to anything?
I don't know. Do you want to check my profile?
What's your name?
I'm allergic to a lot of things, so I lose it quite often.
What's your name?
Opal Villain 13344.
See, I would love to check your profile.
I think I'm allergic to penicillin.
Okay. Yeah, because I was gonna say your profile has nothing but your blood type.
Lovely.
So, we should update that for you. Go ahead and do some lidocaine to know out the area. We're gonna go ahead and clean it out, okay?
Yeah.
Alright, and then we'll go ahead and suture it, exit to entry, stitch stitch. Antibiotic ointment, unbandaging. How is that feeling for you?
It's okay. It's feeling a lot better now.
Active 7.
Okay.
She gotta make it. 23.
Do you want to update your ICE contact
Tell him no,
information?
Tell him no. Tell him I'm not gonna make it.
Oh, I can't tell him that. I have an oath. Do you want to update your ICE contacts?
Tunnels.
Because
Wait,
all
what
you
are they
have is
right
your
now?
blood type.
What?
Yeah.
Did it get wiped? I shouldn't have got wiped. I'll do it another time because I'm about to go to bed, so I'll do it another time.
Pick up the.
Okay, you said you're at least allergic to penicillin, right?
Yeah, penicillin. I'm allergic to bees as well.
Arabella, are you free?
Oh, I'm allergic to do you know the plasters, like bandages and everything. I have to have a certain type of like material because I'm allergic to the main one. Okay, that's
either
all I
the
know.
back
That's all I
Okay,
know.
guys.
Mission Row PD or on the highway there's like a...
Yeah.
Yeah,
Good thing I
thank
did
you
a
very
little
much.
gauze on you.
Yeah, thank
Okay,
God, or
that's
else I
all
would have
seen at the
died.
airport, doing a-
Thank you, man.
You're welcome. Alright, sorry, I was with the patient. What do you need?
I don't even know. What's your guys' first
got-
priorities around here?
Hey, officer, can I borrow you?
Currently
Uh,
in
that,
MRI.
what do you need me for?
It's just for a quick thing.
And for give me a second.
Yeah.
We have no time.
Wait right for me.
Here you go.
You're gonna have to take him to Nancy because I have a patient in MRI. I am in route.
Fractured, broken rib on the left side and protruding into the lung.
But wasn't there something with her eyes earlier? Was there nothing with that? Or I thought you were looking at her eyes
looking for
earlier.
it, but yeah.
Okay.
I mean, I can have another look.
Huh. Yeah, because I could have swore I saw something about a blown pupil. Give me a second.
Okay. Yeah, I don't see that.
Okay, so are we gonna need a surgical?
Code 4 on that 3-1 division. 76, 2 layers, 2 on 1.
Sorry, he started talking on radio. Are we gonna need surgical intervention for the skull is what I'm gonna look at. That lung, I understand, I gotta take care of that. I just need to make sure that we're not gonna need to also focus on the brain here. So a fellow temporal damage person. You know how fucking annoying it is doing my job with a fucking nasal cannula? It's fucking annoying. But it's okay. Okay,
Wait,
well...
did you see the head injury results or not?
Yeah, I saw the minor... The fucking... Hello? Brain? Minor, swelling, which I'm gonna do mannitol for, but I also saw the concave in the temporal lobe. Concave fracture, small concave fracture, which could... But also could not use surgical intervention, so I'm just making sure.
Okay.
Just trying to see. 10 bored? What? I should say 10 quiet, not 10 bored. Anyway, I'm gonna see if this needs surgical intervention. Just a yes or no, simple yes or no for the brain. Or brain, skull. Okay. Okay. Excuse me. Nancy, here, I'm gonna need you to do this. Because Nancy's trying to help me, but Nancy's struggling to get her through the door.
Nancy,
Okay,
stop holding the door shut, what the fuck?
She was trying to play a prank on you, apparently.
Which one do you want, this one?
Yeah. Alright, I'm gonna go get my scrubs on. Just can you get her propofol and check her profile, make sure she's not allergic to anything? Thank you. Oh, hi! It's Dakota? Hello, can you take her to Nancy? I actually am about to go get scrubs for surgery. I just saw a puppy. I'm sorry. Romanov 42 is gonna be in surgery if you need me. No, you don't. Hi, Dakota, baby.
Fine, noted.
You like chicken pesto pizza? Alright, Dakota. I missed you. Hope to see you again. I gotta go take care of somebody. Bye! Sorry, I saw a puppy. Dakota's out there.
You know, I would hope that somebody was here.
She's got no idea on her. I'll put her on profile.
Does the officer probably know who she is?
No.
Fuck, okay.
Oh, I've got a feeling she may be newish to the city. But...
Nah, I'm up.
Go ahead and check for a medical bracelet, dog tag, anything like that that would have any kind of allergens listed. Even a phone, like, ice list will have her injuries. Not injuries, sorry, fucking, you know what I mean. I mean, for me, I have the medical bracelet and a list on my phone for my allergies, so.
I'll just have a medical bracelet.
Yeah. Is there any allergies or need to know injury? But I see one right there.
Yeah. Amoxicillin allergy. Do you see the first one?
Borxa? I don't know if I'm spelling this right. I'm not finding that. Oh wow, I'm a dumb fuck because I was looking in the wrong place.
Yeah, I've got to spell it already.
Okay,
Have you got it?
I found it.
Ah.
And I'm also gonna add that allergy to her list real quick. Moxicillin. So anything in the Cillin family I will try to avoid just to be safe. So we'll do doxycycline. Okay. Dr. Phil, I'm gonna need your assistance in OR 1 upper. 1? 1. There's no fucking numbers, I'm sorry. The one next to, across from fucking triage, okay?
I mean, it's the first one we come to, so let's go with one.
Alright.
The one with the patient in. Let's go with that.
Exactly.
The one that's occupied.
Exactly. Okay, what have you put in?
IV propofol. It should be taking effect now.
IV propofol. She should be asleep. I'm gonna go ahead and apply some doxycycline to the IV. It's an antibiotic. Thank you.
Okay.
Okay, applying some doxycycline. It's not a part of the Cillin family, so it should be safe. Gonna go ahead and start her on that saline bag as well. A new one. Alright, was it left or right lung that we were looking at? Nancy. Oh, hiccups. Ryan, do you remember if it was left or right lung?
Left.
Left, okay. 10-4. Dancing on the moon. Okay, alright, I'm gonna go ahead and inflate this. Nipate. Now we're going to go ahead and attach the ventilator to help her breathe. Okay, I got the floating rib. See if I can safely remove this from where it is.
Echo 776-311. Hello, Dakota.
Okay, well, I'm gonna go ahead and pull it out because it's the only option I have since I'm not really seeing if I can pull it out or not. I'm gonna go ahead and tie it to another rib for now. Okay, we're gonna go ahead and I'm surprised the blood pressure is going up the way it is, but pretty fucking fast, Jesus. Go ahead and apply a Atenolol. This beta blocker should help with the fucking skyrocketed blood pressure. Okay, I'm gonna apply this biomesh here. Let's see if I can suture it to clear this lung. Okay, saline to check for bubbling. Bubbling is air escaping. See if there's any bubbling right now. Okay, good thing we have no bubbling. Biomesh is holding. Now let's check her O2. Her lung. Inflating and deflating lithally. I have SPO2. Okay. Alright, we're gonna go ahead and untie this rib and debride it. Okay. See how this holds. We got the bone cement here. We got the rib splint and a couple screws. Bone cement should be holding well. Make sure we're doing good here. Alright, we're gonna suction ear gate and see if I missed anything in here before we close her up.
Patients treated on scene. 76, 2 ladies, 311.
Alright, I'm gonna check that head wound one more time and make sure I was understanding properly that it will need correction or if it will heal on its own. Will we need plating or... Okay, Dr. Phil, stay with this patient for a moment. I need to eat because I don't want to pass out in the OR room. Be right back. Don't mind me, I'm gonna go back in there. I'm just making sure I don't pass out in the OR room and I need to eat in the sanitary area.
We got death threat. Hello?
What the fuck?
Hello?
What?
What?
Wait,
What?
Are you a doctor dressed up in
I
disguise?
don't think she is.
I'm actually busy. I'm only out here to eat.
Okay.
See, I told you.
I'm sorry. I just need to not pass out in the OR room when I'm with the patient. I don't want food in her fucking chest cavity. People. How are you doing today, officer?
I was doing pretty good.
Was.
Yeah, I was responding to a call and hit that lady. That's why she's in there.
Jesus. Okay. Alright, I'll go back in there.
All right, best of luck.
Alright. Code 4 patient being taken back to pillbox.
minor head trauma and a potential slipped disc.
Oh, she's gonna hate me a little bit, and I'm sorry. Your beautiful, beautiful luscious locks are gonna have a little bit of a bald spot. Let's see if this will work, or if I need to remove.
It's 1576 to latest free.
Okay, I have now situated on a more elevated level. I elevated the depressed bone fragments here to the level position. Let's see how her vitals do with that. A couple plates here. Plate this one. Alright, how's that? Oh, shark bait. Ooh, ha, ha.
It's 15 is 23.
Okay, Nurse Nancy, are we thinking about ICU or recovery?
Goodbye.
Let's lay her back down to recovery. Okay, I gotcha.
Good, man. Fucking stressful. I got the call. I rushed over here.
Oh my gosh, is everything okay?
Nah, I'm just waiting for the officer. Oh, there you go. Oh, damn, never mind. I think it's a judge or a lawyer. I tried to come in and get like a little improv acting going, but yeah, didn't read the room.
Hello.
Hey. Oh, where am I?
You're in the hospital.
I hate hospitals.
Psi 17 to Arabella.
Oh, what happened?
Send it?
Question about the patient earlier, the torture victim. Did you happen to see any sand?
I was more focused on the missing limbs and carvings to look for sand. I apologize.
That's all good. I didn't know if you happened to see anything afterwards.
No, unfortunately. I wasn't able to look.
All good.
Alright, sorry about that.
Thank you. I'm gonna hop off radio.
What
10-4,
happened?
sorry. You can ask this officer over here.
That's 15.
What happened?
Hello, ma'am. Do you recall where you were at about half an hour ago to 40 minutes?
No.
Okay. So you were crossing the street next to Pink Cage, if that rings a bell?
No.
I was coming up the hill. You were like right on the other side of the hill from me. I was responding to a call. Barely seen you at the last second. Went to swerve. Thought I missed you. I unfortunately struck you with my vehicle.
So you put me in the hospital?
Yes. I did. Correct, man.
I found the supervisor.
Okay, I can get somebody down here.
I do want to say one thing though. At least he stopped. There's a lot of officers who I've seen who haven't.
I want to tell supervisor he did a good job.
Fair enough.
I don't know many police officers that would stay with me in the hospital. Most would leave.
Yeah. Alright, I do have some morphine for you. It's gonna be on a little bit of a drip.
No morphine.
No? You don't want morphine?
Mother was addict.
Oh, you're an addict.
No, mother was an addict.
Oh, your mother was an addict. Okay,
I don't want it.
Okay. That's why I didn't do it. I wanted to
I
wait
will
till you were awake.
I'll stick with pain.
Oh, we might be.
Builds character.
We can do some Toradol. It's not. It's non-addictive. Well, I mean, it's not an opioid.
Okay, let's do that.
Okay. Alright, here you go. It'll help you with the pain, okay?
Thank you.
You are welcome.
7 is 10-7 per 2.
If you need anything, have the officer come get me. Otherwise, I'm gonna go write your report.
Will do, thank you.
You're welcome.
I'm just trying to get a hold of one, ma'am. Shouldn't be too long.
No, it's okay. I just wanted to...
Look, I'm gonna hide real quick. Romanov 42 is 10-7 writing report. In the bathroom, apparently.